technology. My name is Joe Eyawo. Welcome to Platform Media International Political Arena. In the past few months, the world has been ravaged by COVID-19 pandemic. From the east to west, north to south, there have been no exemptions. And the world is still yet unable to find solution to that pandemic. Tonight, we have a very good resource to benefit from his immense academic excellence and achievement, who is vast in global health, to discuss the COVID-19 pandemic. And his name is Professor Oghenowede Eyawo, who is a professor of global health epidemiology at the Faculty of Health at York University, Toronto, Canada. Born and raised in Nigeria, he got his bachelor's degree from the prestigious University of Benin in Nigeria. After that, he moved over to Karl Fraser University in Austria for his master's degree in public health. Thereafter, he moved over to Canada for his doctorate degree, specializing in epidemiology at the prestigious Simon Fraser University, SFU, Vancouver, Canada. He is here tonight to discuss this, and I'm sure viewers around the world will benefit from his immense knowledge of global health. And Professor, welcome to the program.
Thank you very much for having me, Joe. It's a pleasure to join to have an opportunity to talk on your platform.
We're excited to have you here because we'll be talking about this COVID-19. And I remember that you, what brought us to this topic, because you have released a paper that has been, that have stirred up the honestness in the academia across North America and around the world. And where you were talking about COVID-19 and the shortcomings of African leaders. And this has become relevant given the issues COVID-19, how it has ravaged the world, and particularly Africa and Nigeria, where you come from, because the topic of your paper is the rude awakening for political elite in low and middle income countries, which of course Africa belongs to the low income countries. And you were talking about how African leaders can react to the pandemic. Let's take it from there, sir. Professor, what is the appropriate reaction that you expect from African leaders given the COVID-19 pandemic?
So the reaction is multifold because, as you know very well, it is a very complex problem. For once, what I've tried to argue in the paper is that COVID is making leaders in Africa realize how important it is to invest in universal healthcare, because it is the condition under which people live that determines their health. There are no infrastructures. In terms of what Africa needs to do, there's just so many things, okay? Now we jumped on the bandwagon like everybody else in high-income countries and instituted restrictions in Nigeria, across other African countries. What we forgot by adopting these policies is that when these policies were instituted in the West, in high-income countries, they also in parallel provided structures to allow people comply and live comfortably. For example, for those who can work, the governments are paying them a monthly stipend. There's access to water. The nature of the living arrangements here is different. In Africa, we don't have structures. You are telling people to practice hand hygiene when people don't even have water to drink. Joe, think about it. You are asking people to practice hand hygiene. People don't even have water to drink. So there's just so much African leaders need to do. They need to rethink. There needs to be a rethink of how we define health. Health has to be looked more like a collective responsibility not just on the individual, but on the individual as well as the state. So African leaders need to invest in healthcare, not just because of COVID, but for a variety of reasons to improve people's health. If people are well, they can contribute to the economy. Well, there's plenty of time, but I'll talk more about the specifics of what needs to happen. But the important thing is, what I've argued in the paper, is the fact that for the first time, the very first time, African leaders are waking up, and I hope they actually wake up, okay? Because in the past, whenever they fall ill, as you know very well, they're up on a jet, before you know they're in London, they're in the States. When their family gets sick, even with malaria, they will fly them abroad. COVID changed all that. Now they can't fly out anymore, and that's the point. So we're hoping this self-realization that they themselves, their family members are vulnerable, would make them invest in the healthcare that would benefit themselves as well as the rest of the society.
Prof, we all know that we don't learn from experience. Experience have taught us that human beings don't learn from experience. That you and I know. Yeah, can you hear me?
I lost you for a minute, John.
Okay. You and I realize or do know that African leaders
yes.
take pride in ferrying themselves across the globe, looking for a solution to their health crisis. And it is a thing of pride for them to say, I went to America to seek for help or to seek for treatment or cure. I went to Europe, and that's the bane of African society, where leaders find pleasure in wearing foreign clothes, ride foreign cars, take pleasure in using the most expensive phones, take pleasure in jumping to the next airplane and travel to Europe or America to seek for medical help. Do you even think, I know that you are in the health sector, let's talk at the political system. Do you even think that these African leaders have learned a lesson they will ever learn, that given what COVID-19 has brought to the fore, that African leaders will change?
That's a very good question, Joe. I wish I knew the exact answer. I wish I could read the minds of all the leaders. But I'll tell you this, okay? COVID has touched very close to home for some of these leaders. This has never happened before. How many times have you heard a political elite die from an illness that potentially could be cared for? For the first time, people in high level, people in political office, some are falling sick, really, really sick. Some are even died, not just in Africa or maybe in Nigeria, but even across the world. So we're hoping this whole idea of self-enlightenment, for once the leaders are becoming enlightened of the need. The reason why some are getting ill, they can't treat them at home, is because you don't have proper hospitals, things are not functioning, there isn't enough funds for the healthcare system to support hospitals and other services, training for staffs and all those sort of stuff. Hopefully, COVID will make them just realize, if not for the purpose of the citizens themselves to improve people's lives, for their own selfish reasons, maybe COVID will do the trick. So we're only hoping. But I wonder, like you said, we've learned from history that after a little while, maybe when COVID is all over, they might go back to their same old ways again. We hope that's not the case. And I think one of the things the paper is trying to do is to highlight that fact and bring them to that recognition why it is key for them to support healthcare at home.
Given your experience in managing public health, let's go back to Africa.
Yes.
I know even that North America, people have started ignoring the social distance.
Yes.
I saw on television today in Lagos, everywhere in Nigeria, people have started mixing up this tendency to believe that Africa is hot and therefore it's the disease cannot fester or cannot survive, or the virus cannot survive in the hot weather. Can you enlighten them, people who are watching us? Is the hot weather a cure, what kind of restrict the spread of the virus? Is that the case? Can you give us the mystery? Break that mystery, the myth.
No. Hot weather is not a cure. It's not a cure. That's a complete myth. Initially, when the virus and infections the numbers were skyrocketing in the West, and it wasn't happening in Africa, people were thinking maybe it's the climate that was helping. What we've come to learn over the last about 6 months or so, it's got nothing to do with the climate. Look at the numbers. Look at the Nigerian numbers, for example. It's going up every day. Today, I think just yesterday, June 16th, over 500 or so new cases were identified. So, what if the weather is being a factor? Why are people still getting infected? So it's got nothing to do with the weather. Part of it is part of the reason we've seen the numbers low, in my view, is perhaps because there are multiple reasons. But one factor is we may not be testing as much as we should be. Because if you don't test, how would you detect cases, right? So imagine you're testing vigorously, you probably will be identifying a lot more cases. In terms of the number of deaths, as you know, it's not as high as in high-income countries, and there are some explanations for that. I'll give you one key one, okay? In high-income countries, including in Vancouver, where you live, Joe, a lot of old people live in the big cities. And infection rates are higher in these metropolitan cities, like in New York, in Toronto, generally in big cities. In Africa, a lot of old people don't live in big cities. You know that. They live in the villages. So the potential for transmission is somewhat reduced. I'm not saying it's completely out, but it is reduced when you live in like a rural area setting. And because in our big cities, it's mostly a lot of young people who are young, energetic, vibrant. And what we've come to learn in terms of the mortality, the rates of death among younger folks are not as high compared to older people who have other comorbidities or other conditions they are dealing with. Some have high blood pressure, diabetes. So those things just exacerbate the problems of COVID. So I think that's part of the reason why we see the deaths in Africa at this point may be low. It could also be an issue of underestimation. People die in Africa, they just get them buried. They don't even do like cause of death classification or trying to understand what they died from. So it's also possible we may be underestimating the true number of deaths. So that's another potential reason. But to your question, nobody should kid themselves. COVID, the hot weather doesn't do anything. It's not protective, and people shouldn't get complacent. COVID is still very much alive. Look at China, for example. China, who said a couple of weeks ago they never had any cases. In the past few days, there's been about 100 cases that have been reported. So it's got nothing to do with the weather.
Okay, what do you say about the school of thought that have it that the record in Nigeria, or for instance in Africa, is low because there's no accountable, they don't have good metric system or whatever to account for the numbers of people who are suffering from it. Because, as you said, COVID have no boundaries. It is everywhere. It is not because Africa is hot or Nigeria is hot, that is why it's not there. But some people say the numbers in Africa or Nigeria could be low because there's no way, there's no comprehensive system of giving account of those people who are suffering it or those who are dead. For instance, I have 3 relatives in the morgue right now. We don't even know what would have resulted in there. Although they are 2 of them are quite old, in the 80s. That's quite a number in Nigeria if you are in the 80s, right? So what do you have to say to that? Because I do believe, when I also have that thought too, that it's as a result that we don't have good accounting system to keep the number, to actually account for the numbers of who is suffering or who died from the virus.
You know, you raise you raise an issue that we probably could even talk about for an hour. The issue of data collection. Let's even start from here. In Nigeria, we're still having debates of what is the population of Nigeria is. Some people say it's 180 million. Some people say it's 200 million. We don't even, some people, so you can imagine, even in a country, we don't even know how many people live in a country. Talk less of even knowing people who are dying. So what this speaks to is there is a dire need for improvement of the data collection systems, because you can't plan. You can't plan. Think about, let's just go back nuclear. A family of 6 people, let's say yourself, your wife, you have like four kids. You plan based on the size of the family. If you're going grocery shopping, you buy stuff with the knowledge that, okay, we're 6 of us at home, or if you have visitors, you shop a bit more. So effective planning can only be done if we know the population figures. And this is so critical for healthcare. In Nigeria, I think part of the reason we're where we are today is because we have no clue. So we'll be reactionary instead of trying to be preventative. All we're doing is, okay, there's a problem, we just react, try to fix. That's not how you solve problems. It's better to take the right steps. So I think that there's one of the points COVID raised is the realization of how important it is for us to collect good, accurate data so we can use that to inform and guide decision making in healthcare. So I agree completely with you. We are falling behind on that end, and we need to do better.
So what are your recommendations, Prof, in terms for at least ameliorating the spread?
I see healthcare as a collective problem. So I won't say it lies entirely on the government. I think the approach should be a collective approach. And I'll make 3 suggestions. I have suggestions for individuals. I have some suggestions for businesses. And I also have suggestions for the government. So for individuals, I think the first thing is we can't be complacent. Like COVID is not over yet. I know in Nigeria, for example, they're losing up all the restrictions. People can go to work now in a lot of sectors, but people should not kid themselves. COVID is still very much alive and well. And in fact, in Africa, the rates of infections and the number of daily infection counts are going up every day compared to last month or 2 months ago. So that is the first thing. So for individuals, a couple of simple things they need to continue to do. They cannot be complacent. They still need to take all the precautions. If it's possible, one thing I would ask individuals to do is, if you can, avoid crowded places. It's just one thing. I know this is difficult in a society like Nigeria, where if you have to go to the markets, how are you going to avoid a crowded place in the market?
You have to.
But there's
and they also have elaborate wedding, have elaborate church services, elaborate worship in the mosque.
So it's really difficult, but here's a potential solution for that. If you must be in these settings, you have to continue to use masks. You have to wear masks. You have to practice hand hygiene. Wash your hands as often as you can, because that's where this is the portal through which the infection happens, right? Your hands touches the virus somewhere, and then you put it on your mouth, your face, or your nose. That's how people get infected. So that's one thing that's a couple of things individuals can do. Avoid touching your eyes, avoid crowded places, take COVID as something that's still very serious and real. So people should not get complacent. And one way to protect other people is, if you're sick, you're really sick, just if you can, I always like to use this clause, if you can, because sometimes in Africa, just because of the nature of the situation, sometimes people don't have choices. Okay, but where it is possible, if you're sick, self-isolate, and there's some helplines that you can call, but try and protect other people. Okay, so that's some of the things individuals can do. How about businesses? Joe, you wanted to say something?
Yeah.
I see. I was driving home.
I was enjoying it. I was just nodding, Prof, because you're taking me on a very high way of enlightenment. There's one other thing before you. I will remember to come back about business. Trying to recommend it. There's one other thing that your recent paper, which is of interest to me, Prof. If you let me read that to you. One of the recommendations you made is enlightened self-interest of political elites may finally provide sufficient motivation to invest in an effective and integrated health system. Can you illustrate that further?
Yeah, I can. So enlightened self-interest, okay, until COVID came along, it's always the arguments for why politicians should invest in healthcare has been based on equity. Be fair, be a good leader, help your people, provide the environments that make your people well. So all arguments to encourage leaders to support the healthcare system has been based on equity-based arguments. Just be a good leader, be a great leader, help your people so people live good lives. That has not worked, as you and I know. Okay, another colleague of mine sent me a picture of an hospital. I believe it was in Uganda or somewhere that was just adjacent to like a state house in an area where malaria is endemic, and they had no mosquito nets at the hospital. Okay, malaria is endemic. This is an hospital that you don't even have mosquito nets, and this hospital is directly adjacent to the state house. That just tells you the lack of investment. Like the leaders don't even care. So what we're saying by enlightening self-interest is essentially that because COVID has touched too close to home, it's affecting a lot of leaders. As you know, I don't want to call names. We follow the news. It's affecting political elites all over the world. And that has, when something hits close to home, it enlightens you. And it's self-interest. So we're hoping COVID will be the motivator for them to do the right thing. So that's essentially what, in very layman terms, that's essentially what that sentence or that statement is trying to get at.
Looking at what is going on, do you fear for Africa or Nigeria using the COVID-19 pandemic? Do you fear genuinely?
Yeah, I would say I worry. Okay, I won't say I fear. I'm always as you know me well, Joe. I'm always very optimistic. I worry, but I hope. I hope things can be better. And the reason I continue to have this hope is because I know we can do it. Okay, we have the capacity in terms of the resources, in terms of the manpower, in terms of the know-how. We know what needs to be done. Joe, what is lacking is the political will to do the right thing. That's all.
And that's a big problem. And that's a big problem. It's like a huge mountain in front of Nigerians because we don't have the leadership that have the willpower to position the healthcare to come to fight a crisis like this. You and I, look at it. When you are based in Toronto, I'm based in Vancouver in Canada, look at the palliative that the government has given to its citizens. Just today, the Prime Minister of Canada has extended the palliative, to all the citizens by another 8 weeks. People can choose to stay at home. People can distance if there's no hunger. But Nigeria, there's hunger. You cannot tell people to sit at home when they are fighting hunger. So the argument that most people that I talk to in Nigeria say they would rather die of COVID than allow hunger to kill them at home. So I like your optimism, Prof, but sometimes it's good to also say it. No system can work with the citizens when they are hungry. Do you agree to that?
I completely agree. If for us to win the fight against COVID, and for the restrictions and all the measures that has been in place for it to work, the government has the responsibility to create the conditions that would allow people to comply.
That's right.
And this is what a lot of leaders in high-income countries have done, including in Canada, like you just said. If you're asking somebody to stay at home and not go to work, and you're giving this person like some amount to help him survive, this person will be more likely to follow these measures. That's not the case in Nigeria. At the start of the epidemic, maybe a couple of months ago, we heard, and I talked to families and friends back home, that government provided some palliatives which nobody saw. They never received it, but it was in the news. So the question again is, where did these monies go? Where did these palliatives go? Who got it? Who got it? So these are the issues. There's just so much corruption, lack of transparency, lack of accountability. So the Nigerian problem is quite complex, to be honest. But I completely agree with you that, and I don't blame people who talk about, they have to take care of the hunger virus first before they consider COVID. So all we can ask the government to do, and I'll repeat this because I mentioned it earlier, the government has to create somehow, they have to find a way to create the conditions that would encourage people to comply. As simple as that. Whatever that is, whatever that means. If you even, like when we started this conversation, I was talking about hand hygiene and regular hand washing. People don't have water to drink, and you're asking them to wash hands with soap. Some people bathe even without soap. Okay? This is the reality. Joe, you and I know it. There are people who bathe without soap. It's not like they don't want to. They don't have access to it. So the problem is a bit more complex. I think if the government really wants to get to the heart of the issue, we should be addressing more systemic problems. So it's problems that are larger than just fixing COVID. We're being reactionary right now. We should be looking at the root of all these problems. Government, look at China, for example. When in February, China built a 1,000-bed hospital in 10 days in Wuhan. Okay, massive infrastructure development. Can Nigeria not say, okay, now people don't have water in these communities across Nigeria? Can we come up with a large-scale project to ensure there's access to water? I like going to water because water is life. Okay, water is life. People are dying from a lot of preventable disease in Nigeria, in many low and middle-income countries, because they don't have access to water. So there are so many things they can do, and we can continue to have conversations about this. But if the government is truly serious, they need to create the environment that would ensure people comply. It's as simple as that.
Prof, it has been worthwhile, the time, and we're excited at Platform Media having you to discuss health issues as it relates to Africa. We're excited to have you in our program. I know that you are an incurable optimist about Nigerian state. We have to thank you. Nigeria is wasting their talents away. People like you should be consulted on how Nigeria should be move forward. And I have to thank you for sparing your time to speak with us. And I hope our leaders are listening, and Canada is putting you into good use rather than Nigeria putting you into good use. But it is not our fault. But it's our fault. All we can do is what you are doing from here, sending good messages and giving us people back home in Nigeria and Africa on how they can combat this COVID-19 pandemic. And I want to thank you for that. And I hope you come again and each time we call upon you. Is that a promise?
Thank you first and foremost, Joe, for having me on your show. This is it's exciting. I mean, this is what I do. I work in global health, so I'm always open to discussing issues, and definitely we all come from Africa. Whatever we can do to support in whatever capacity that's needed, we're ready. I think we have what it takes. We have the resources. We have the know. There's so many, very many highly educated Nigerians abroad who are supporting Western societies, and they're ready. They're ready to support back home. Thank you for the kind words. I'll be happy to join your program again, and I hope our leaders are listening. We know what works. We just need we just lack the political will and the right people in the right places to make these changes. Thanks, Joe, for having me. I appreciate it.
To our viewers, that is Professor Eyawo, a professor of global health epidemiology at the Faculty of Health at York University, Toronto, Canada. Professor, we are glad to have you again, and I wish you well, and I hope the weather is improving. You've just gotten this position. We miss you in Vancouver, and I hope we'll keep this connection. And you have a good day. My regards to your family, and I hope to speak to you again.
Thank you very much, Joe. We'll talk soon. Have a nice evening.
Well, viewers, that's Professor Eyawo of York University. And meet us on Twitter, Facebook, and Instagram. I'm yours sincerely, Joe Eyawo, signing off on Platform Media Political Arena. And to our professor in Ontario, Canada, I say have a good night. And viewers, you have a good night too. See you again. Bye-bye.